So tonight's subject is buckwheat, and this pseudo-grain from China initially. The early studies show that 1,000 years before Christ or BC, 3,000 years ago, that this was initially being used in the farming of the local lands in China. But it's more predominant in Eastern Europe and more recently in Northern America, and it is deemed a superfood. So one of my colleagues in the field of helping people with chronic pain says, "Hey, Wayne, can you talk about buckwheat? What about buckwheat? Is that something we should be advising patients on?" So I dived into this a little bit and have come up with a few points to go over, and then a big take-home message at the end, which can apply to many foods that maybe, are maybe not on the yes list or the no list. If you follow Dr. Stephen Gundry's advice on inflammatory foods. But, it's a food that literally is an alternative to options for grains if you don't want to eat wheat. So if you're gluten sensitive, or less common if you're celiac and you're looking for a non-gluten form of a grain, buckwheat is definitely one to try out. So what are the aspects of this? Well, let's look at the clinical benefits of this food first. There's 7 clinical benefits, and we'll just go through a few of them. First, it improves heart health. Studies on this have shown reduced inflammation and reduced heart attacks, and therefore it's advised for your cholesterol levels as well as your blood pressure, and it's been shown with positive health outcomes in the literature. So if you've got a healthy heart and you want to keep it that way, this is maybe one for you to try. 2, it contains disease-fighting antioxidants. Those are compounds in the body that fight free radicals, that fight aging and helps the DNA of our cells, and literally stops disease processes happening within the body. Yeah, it's actually the phenolic compounds that's within this nutritional food that can help not only heart disease, but also cancer, as well as Alzheimer's disease. The next is provides a highly digestible protein. That's right, it's a plant-based protein. So if you're following a plant-based diet, this would be one to consider. It has 12 amino acids, which are the building blocks of protein that's required for growth, energy, and muscle synthesis. It contains roughly about 14 grams of protein for every 100 grams, which is not quite as high as quinoa, but higher than most whole grains. The couple of essential amino acids, lysine and arginine, are found within this compound, which is essential for your body needs. So the next thing, number 4, it's got a high fiber content. So what that does is helps you makes you feel full in your stomach when you're having a meal with it, and also improves your digestion, prevents that oxidative stress within the colon, and also fighting the onset of liver cancer, colon cancer, and cancer of the rectum. Number 5, it can help prevent diabetes because it's got a low glycemic index, which that means it reduces the surge of glucose and then insulin into the bloodstream every time you eat it, and it can help with inflammation and also fatigue if you've got this condition. Number 6, it contains non-allergenic compounds, and it does not have gluten. As I said at the beginning, it does not have gluten. So if you're on a gluten-free diet, this is definitely a food to try out. You may be thinking, but it's called buckwheat and is not the same as wheat. And that's something I initially thought when I looked into the subject, but it's a completely different botanical family, plant-based families, and it's not the same. And it's not really a grain, it's actually a seed. You may be seeing it in the stores as kasha. I remember back in the day when I used to buy lots of grains, and I used to buy this kasha product with buckwheat in it. It tastes very good, very nutty, flavorful, and it's definitely worth a try if you haven't tried it. And also number 7, it's got important vitamins and minerals. So let's go through the list of vitamins and minerals. Manganese, magnesium, phosphorus, niциum, zinc, iron, B6, folate, and pantothenic acid. So really important minerals and vitamins in there that our body needs. We don't really think of these things unless you're maybe taking a supplement, but it's essential. And this food is wonderful because it's got lots of healthy, natural minerals and vitamins. So the question is, do I recommend it? Well, at the end of the day, it's interesting because if you look at Dr. Stephen Gundry's list, it's on the no list, which means, according to him, it causes inflammation. But with the other studies out there, it shows to reduce inflammation. And in fact, this is very common when you look at the research around a subject, whether it's food or medications, you will get conflicting advice. And what I'm going to say is coming from a colleague of mine who I interviewed right at the beginning of my podcast show several years ago. He's in one of the chapters of my book. His name is Professor James McCormick from UBC Pharmaceutical Sciences in Vancouver. And he says, at the end of the day, when we've got any either food or medication that you want to take, and you're trying to figure out, does this work for me? Is it going to cause any problems? Then the only thing you can do is try it and see what happens. So my tip on buckwheat would be, number one, reduce inflammatory foods in the body as much as possible. And for more information, check out the other live streams or my Anchor or Medium presence on social media. Got lots of articles on YouTube videos on these subjects. If you haven't checked that out, please check out my name with these social media platforms. After removing these inflammatory foods from your body, you will feel better. You'll have more energy. You'll have less gut upsets, if that's your problem, less IBS, less constipation. You'll probably be sleeping better. And then you introduce it, say for 1 or 2 meals, and see what happens. And if it's okay, you're good to go. Maybe you can eat it once a week and you're great. Maybe you can eat it twice a week and you're fine. Maybe it's only once a month. So again, it's a personal journey. Not only is it taste, but it's the effects on the body that you're looking for. So it looks like a great seed to eat. It's not a grain, but it's actually a seed. And definitely up there with alternative grains for eating, like quinoa. If you cook it in a pressure cooker or slow cook it, it destroys the inflammatory lectins within that grain. And also as an alternative carbohydrate, sweet potatoes, yams, wonderful, with no inflammatory proteins or lectins in that food as well. So hopefully you found this helpful. Please give me your comments. Thank you so much. I'll call you Stephen, who asked me to share this subject. And it's been interesting to research it, look into it, and have conversations with other people about it as well. So thank you so much once again. It's been good to be here, and I look forward to being on the next live stream.